what's really the state-of-the-art of hemorrhoid surgery? Well, it's a challenging topic. It's one where people suffer disproportionately to what problems are really going on. For such a small area of the body, it produces an awful lot of pain and suffering. But one of the things we learn as colorectal surgeons is to understand that each problem, each anorectal problem, is different, and that each requires its own individualized approach. Hemorrhoids really come in two basic types. There's internal hemorrhoids, which tend to be painless but tend to bleed. These can also sometimes prolapse or push outward. External hemorrhoids tend to be palpable and large lumps that people know about, and they also tend to be painful or produce local symptoms of itching and irritation, things like that. And quite often these two go together, so there may be both prolapse and bleeding internal hemorrhoids as well as external large, uncomfortable, painful lumps. Sometimes people can also develop a very hard, swollen lump that's a thrombosed external hemorrhoid. This can be perhaps the most painful of all. And then there are many other associated conditions that aren't necessarily hemorrhoids, but that can also need attention or treatment. The most common of which is a fissure. That's a little tear or split in the lining of the anus. And that can be quite painful and produce a sensation of spasm that perpetuates a syndrome of pain and spasm and bleeding. So it's important, first of all, to have the right diagnosis. Seeing a colorectal surgeon is critical to getting just the right kind of treatment. And then after that, I think it's very important to try to approach the problem as conservatively as possible. We've gotten better with treatments, things as simple as improving fiber, getting the bowels moving and softer, using warm baths to relax the tissues, and then some topical treatments that can often help with both hemorrhoids and fissures. If those things don't work, then surgery may be required. Surgery is generally done as an outpatient procedure. It's something that the surgery is usually not a big long operation, usually a 20 or 30-minute procedure. And what I try to do is tailor the procedure to the person's problem to make it as minimally invasive as possible. So the minimal intervention that we can engage that produces the best results and the best relief of symptoms is what we're after. So I will employ all the techniques that we have, including excision or removal of hemorrhoids, as well as hemorrhoid banding, as well as suture imbrication, as well as in some cases using energy devices. All of these different techniques can produce relief, but we try to use the least invasive technique possible for each application. If one does have very large internal and external hemorrhoids in all the major sectors and a full hemorrhoidectomy is required, it's best to be prepared for that to be painful, uncomfortable, take time to heal up. But ultimately, after you get through those first few weeks, it's usually markedly better. The symptoms are markedly better than they were before. Most people say, gee, I wish I had done it a lot sooner. But it's all about selecting the right person for the right procedure and using the least invasive technique possible to try to get the very best result while inflicting the least amount of pain and suffering and side effects. Sometimes we do have to do a painful procedure. It's not painful during it, but it's painful in the aftermath. And we work with people to make sure they have good pain control and understand that the process is going to get better over time. And it does. People are generally very satisfied with the results after hemorrhoid surgery, although it may take a little bit of time to really realize those gains. Sometimes I see people who've had previous surgery done and we have to do some revision or correctional procedures. And again, it just requires being very judicious, very minimally invasive when possible. But overall, I think the principles of having a very correct and accurate diagnosis, taking a minimally invasive approach, and then preparing the person for what the recovery is like are really the key principles in dealing with the problem of symptomatic hemorrhoids.